20th day of June 2018. A very good evening wherever you're watching us from. Many thanks for tuning in to Y254 News Highlights. And today it's a Health Wednesday where we shall be talking about the budget allocation in the health sector. And with me in studio is Delphine Kerubo, our clinical officer. She'll be helping us to understand whether the government will achieve its agenda for universal health care. Keep it to Y254. Remember, you could talk to us, join our conversation tonight by sending us your comments, your questions through our SMS line 22162, starting with the word Y News. Again, 22162 is the SMS line to use. Remember to start with the word Y News. At Morani Hillary, at Y254 channel, and at Del Kerubo is the Twitter handle to use, and the hashtag is Y254 update. Stay with me to the very end of this program, but right now we will be looking at stories making news highlights, and today being World Refugee Day, we want to know what is happening around the world. My name is Dereva Hillary. Welcome to the program. While many developing countries in the world grapple with huge numbers of refugees and asylum seekers arriving on a daily basis, Cayman Island has only 20 people waiting for a result on their asylum applications. However, as the US, UK, and Italy face criticism over their handling of immigrants, the theme of 2018's World Refugee Day is the shared responsibility the world has for families fleeing war or persecution. And now moving on, small-scale farmers will now be able to benefit from their produce after the Cabinet Secretary for Agriculture and Irrigation, Mwangi Kiunjuri, launched a project dubbed Agrify. The project will allow small-scale farmers to access funds and credit to boost their productivity. Our reporter Miriam Masava brings us more on this story.
Scale farmers contributing to 30% of the country's GDP, they incur losses of up to 20% during post-harvest. This has contributed greatly on the food security in the country. Food security is among the government's big four agenda, and they are greatly dependent on the agriculture sector. The government plans to reduce post-harvest losses from 20% to 15% by enhancing market distribution infrastructure and availing incentives for post-harvest technologies. The government, together with the European Union, is investing 5.26 billion shillings in a value chain program that mainly targets small-scale farmers to ensure farmers' high productivity.
If we are able to empower that small farmer, target that farmer directly, and ensure that they are properly coordinated, ensure that the programs that we are organizing today will be able to have impact, and they start associating themselves with those projects, we are not moving anywhere. And therefore, I appreciate the efforts that you are making to ensure that for the first time, those small-scale holders will be able to access those loans and grants.
The Cabinet Secretary of Agriculture and Irrigation, Mwangi Kiunjuri, launched Agrify Kenya through the Kilimo Value Chain Challenge Fund, which will help finance high-impact development projects within the agriculture sector through targeting smallholder farmers. The project will also create employment as it seeks to reduce over 30% losses due to post-harvest losses. Miriam Masava, Y254 News.
Now to matters health. The Ministry of Health received a budget allocation of 44.6 billion shillings to enhance universal health coverage, which is aimed at guaranteeing quality and affordable health care to all Kenyans. Speaking in Parliament, CS Henry Rotich said that it will involve reconfiguration of National Insurance Fund NHIF and reforming the governance of private insurance companies to align them in universal health care coverage. By the end of year 2020, the government is targeting universal health coverage to all households by the end of year 2022, and of course this will guarantee quality and affordable health care to all Kenyans. But how? This will be achieved by increasing NHIF enrollment for the current 16.5 million to 25 million Kenyans by the end of 2018, expansion of the Linda Mama program to mission hospitals and private hospitals, provision of specialized medical equipment, and increasing the number of health facilities. The key allocations for the year 2018 and 2019 include 4.3 billion shillings for free maternal health care, 9.4 billion shillings for leasing medical equipment, 4.7 billion shillings for Kenya Medical Training Centers, 11.7 billion shillings for Kenyatta National Hospital, 7.7 billion shillings for Moi Teaching and Referral Hospital, 1.7 billion shillings for Kenya Medical Research Institute, and 2.9 billion shillings for doctors, clinic officers, and nurses internship, 7.0 billion shillings for computer tomography scanners used in screening for diseases such as cancer, and lastly 2.5 billion shillings rolling out of universal healthcare to counties. Whether the government will achieve its universal healthcare coverage remains to be seen with this new budget allocation to the health sector. For Y254 News, I am Dereva Hillary. Well, enough that story will be influencing our topic of discussion tonight, where we are talking about allocation of budget allocation to the sector of environment, health, that is. And again, just a reminder, with me in studio is Delphine Kerubo. She is a clinical officer. We want to understand, will the government really achieve its agenda for universal health care? Good evening, Delphine.
Good evening.
How are you?
I'm fine. How are you?
I am fine, thank you. It has been a while since we last met
Yeah,
here.
yeah, a month ago. Yeah.
Well, karibu
Yeah.
sana.
Thank you.
Now, the government has allocated the proposed budget, that is, has allocated quite a good amount to the sector of health, and we can see they are really adamant to ensure that they have attained, or they have achieved the agenda for universal healthcare, the Big Four agenda, that is.
Yeah.
And now we want to understand, because we've been hearing so many things happening around the country. There's this corruption, there's everything that is happening, and we are wondering now, this about 4-point-something billion, what measures, what strategies have you laid, what strategies will be used to ensure that this money doesn't go to waste, or will be used appropriately?
Now, when it comes to healthcare, we're actually complaining that money is not enough. According to Alma-Ata, the declaration in 1978, they proposed that 15% of the total budget to be allocated to health. Now, in the current situation, 2018-2019 budget, the health sector have been allocated 3.52%. So you can imagine that difference. So we have a lot that we are complaining, we want more. We want capacity building for our students. Thank God they were raising money to the MTCs and medical classes. We want you know, the facilities, as much as they're talking about NHIF. Yes, we can all have NHIF cards, yes. When we walk into a facility, we don't have the necessary equipment, the necessary skilled personnel to handle us, the necessary diagnostic equipment. So we are asking, we need more.
You need more.
We
Actually,
need more,
if my memory serves me right, last time it was about 54 billions. Now it has reduced.
It has.
And now, what's the difference? Like, what you didn't achieve the year 2017-2018. Now, what makes the difference that this year, 2018-2019, you will achieve what you want in the medics department?
According to the budget that was proposed, they're talking about equipping facilities on cancer treatment. They're talking about equipping the NHIF to increase facilities from 9,000 to 11,000. Then we're talking about from 17 million people to 25 million people to having NHIF. Now, with us, the health personnel, we are looking back and we are saying, you know what if, we capacity build ourselves? What if we increase, you know, the number of health equipments rather than the number of health infrastructure? There's no need of us having a lot of hospitals, and yet those hospitals don't give quality and affordable healthcare. So we are still complaining.
Now, looking at the distribution, there's so much that has been said, it will be done, it will be done. Now, before I get to that, you're saying it's not enough, but already with what you've been proposed, what will you do with it? As in, it has been said, yes, but how will you ensure that this amount goes to this sector and you ensure that hakuna kucheza na pesa?
Well, there's now, when we talk about achieving health for all, achieving universal health coverage,
Right.
we are talking about the 45 million in the population of Kenya.
Right.
Everyone, whether you are rich, whether you are poor, you have access to healthcare. Now, let's look back at NHIF, the National Hospital Insurance Fund. So this is the design the government is using that. They equip the hospitals, the public facilities. They equip some of the mission-based, like the Catholics, so that they equip them, and then we use these facilities for now the total population to go. But at the end of the day, we don't have enough skilled personnel. At the end of the day, most people are going to India for a transplant. Thus, we are not having enough equipments in this hospital. Yeah, we are not having, enough diagnostic for this. They are saying cancer. Yeah. Yes, we don't have enough diagnostic tools to tell you that this person has cancer in the first stage rather than the fourth stage. Right. Now, we are also telling the government the preventive is better than cure. Why can't we prevent these diseases? Yeah. Right. For example, these cancers can be prevented. Why can't we, focus more on preventing rather than curative? Right. Why? Okay. And another thing is research. Why was money not allocated for research? Because if we research more, we'll get a majority of the gaps, and also with everything that we're having, we can fill in the gap. Yes. According to the research that the people will be doing. Yeah. So we are still far.
Still on research. A few amount was set aside for research.
Yes.
And that was about how many billions for medical research? That was 1.7 billion shillings. Yeah. Is this not enough?
No, it is not enough.
Do we have personnel there?
Well, you see, when you talk about research, we're just assuming that Cambridge is the one doing research. Remember, we are having students in campus. We are having our youths in campus, yes, whom we can actually use for them to do research. We have a lot of brains. In fact, if you compare in the East African region, yes, Kenya have brainy people. Yes. Yeah, people who are, they have innovations. Yes. So why can't we research more? Why can't we, bank more on research, yeah, so that we find the gaps, so that we fill in the gaps? Right. Yes. So that money is not enough, Hillary.
Well, I kind of feel that by the end of this program, you'll have complained enough for the government, yeah, to get to hear you people. Yeah. But now let's talk about mortality rate. What is being done, or what will be done to the people living far-flung areas like Northeastern? Maybe it has reduced, has it?
Yes, it has. I think the other time I was here, we were talking about, prevention of malaria, how we've reduced mortality because of, immunizations. We've done enough. Yes. But we have a long way to go in terms of reducing the mortality rate in Kenya. For instance, how can a baby just die because of diarrhea? Yeah. Why can we just, think about these preventive diseases? Why can't we prevent them before they occur, before we go to the curative stage? Yeah. So let's focus more on preventive. That is what I'm here to say today. Yes. Let's focus more on preventive. You see, one thing about our legislators, yeah. For instance, the cancer thing. Most of the time, cancer was a neglected disease. It was said it was, for the poor. Yeah. But now that they're noticing cancer is affecting them, yes, that's why they're thinking about, bringing up interventions to do with cancer. But yes, we can prevent this cancer. Now, it's high time we just do more of preventive, yes, than curative.
Yes.
Yes.
And maybe just before we move on, someone will be like, how do you prevent cancer? Because we hear it's being triggered. Now, how do you prevent it? Let's just digress a little bit on this one. Okay. How do you prevent cancer?
Well, majority of the factors that contribute to cancer is usually because of your lifestyle, the way you choose your lifestyle. Yeah. Let's talk about smoking. Yeah. Smoking leads to lung cancer, it can lead to heart cancer. Now we are telling people, why can't you stop smoking so that you at least reduce the vulnerability for you getting cancer? Okay, let's talk about liver cancer. One factor is drinking what? Alcohol. Why can't we tell people, as much as you're drinking this alcohol,
Yes.
you are vulnerable to getting what? Cancer. So the way you choose your lifestyle most of the time is how most of the time you get vulnerable to this cancer.
But now the alcohol and cigarettes and every other smoking aspect brings revenue to the country, and we are talking about one of the agendas is manufacturing. Now what happens? We will have ruined everything if people stopped drinking, if people stopped smoking. What should we do then?
I know we'll have, imbalance the economic, yes, but
True.
we have different ways of bringing revenue to the country. We
Yes.
have a lot of ways. We have to just be innovative. We think outside the box and just come up with ways of, coming up with money.
All right. Now let's talk about the interns being paid,
Yes.
the nurses, medical officers. Now, how do they get to benefit? Because some money has been set aside for
Yes,
that.
yes.
Now, how will it
And
cater for it?
thank you, the person who thought about it.
Yes.
I was in internship and I was not paid even a single cent
Even
for
fair.
1 year, even fair, my dear Hillary. So
Okay.
when I hear that most of the interns will be paid, the clinical officers, the the nurses, the doctors were being paid, and nurses, but clinical officers were never paid.
Yes.
So we let them be paid, because at that one, we want them to support them, even they get reimbursement, fair reimbursement, or
Yes.
even to survive in that 1 year during the internship.
Yes.
Because internship, you're actually gaining experience while working.
Yes.
So at the end of the day, you need to be
need to be paid for
yes,
what
you
you're
need to be
doing.
paid for what you are doing.
And
yes,
most assuredly, many youths will benefit from this.
many youths. Yeah.
True. Now, still on matters internship and budget allocation for
Yeah.
that. Now, let's talk about the employment factor. Now, with this proposed budget, will we see specialists being employed? Because over time we've heard you people complaining that you're being overwhelmed,
Yes.
you're not being paid well. Do you think this budget, however small you claim it is, do you think it will cater for employment of new specialists?
Well, you see, in America, the health sector is the #1 employer in America.
All right.
Yeah. So you can imagine, if we invest in Kenya, if we invest in health properly, the way it is supposed to be 15%.
Right.
Yeah. How many people, how many youths will get, work? Talk about preventive side, preventive department. We have public health officers, we have environmental health officers, we have, occupational health officers. That is different. Higher. Let's go to curative. We have, clinical officers, we have nurses, we have lab technicians, we have pharmacists, we have the doctors, and we have the consultants. So many people can actually get employment through the health sector, if and only if,
Right.
yeah, the money we are given is well consumed, and actually they increase the budget allocation at the health sector.
Yeah, you
Yes.
just talked of United States, and I'm like, that will take 100 years for us to achieve that, because we are just 55 years old. I mean, how do we compare with the United States?
Okay, you see, they're like our mentors.
True.
They have been there.
True.
So we need to do shortcuts, so that we survive in future.
Right.
We need to have like mentors from the United. How did they do it? If they did it, we can also do it.
So
Yeah.
maybe if we begin today, gradually with time, like now, say 100 years to come, we'll be in their position.
so okay. In fact, let's just go to our role model, the Cubans.
Right.
Do you know the Cubans, the capacity, the amount they allocate for health is 27% of the total budget. In fact, it surpasses the Alma Ata Declaration.
Right.
Yeah. So why can't we learn from the Cubans, since we went and exported, their doctors to come to Kenya? Why
Yes.
can't we learn so much from the Cubans?
And actually, their coming has brought a lot of uproar in the country. And maybe I would like to know, what impact do you think they will be having on new people in the health sector? Do you think they will impact you? A lot is being said about them coming. What do you think they will be? Will they be helpful?
Hillary, you see, just an example. This is my house. I know the problems.
True.
I really know the problems from, you know, top to bottom.
Right.
Why should I go call a neighbor and come solve my problems? And me, myself, I'm the one who created the problem, and I know myself how to solve them. Well, that is one way.
Maybe
of
you've got
looking
to a
at it.
point where you can't handle yourself anymore.
How can you not handle yourself? Anyway, that is one way.
Right.
Another aspect is, okay, to be positive, well, they say they're coming to capacity builders. We have to learn from them. So we are thinking, how will the capacity building be?
Right.
Will they focus on students? Will they focus on the doctors? Will they focus on the consultants? There's no a structured way on that capacity building. Then, the problems you're having in Kenya, most of them are preventive problems, not curative.
Yeah.
When you look at Cuba, they are very innovative. Yeah, their way of training is up. Iko huko juu. Now we are asking ourselves, why?
Maybe they want you to learn from them
gap.
when they are close, not from online. They don't want you to go there. They want you to learn from the ground. You don't have to travel to Cuba to learn what they do.
Well, what you can say, let's just accept them. We see maybe for 6 months, we see the changes they'll bring.
Yeah.
But the problem that we're having in Kenya will be solved locally, if and only if the government is serious.
Speaking of Cuban doctors,
Yes.
they have come, they are here.
Yes.
And now the budget has come. Does this budget cater for them?
Yeah, it has to. It has to.
has to.
Yeah, it has to.
So that's why most of you are complaining, and again, you're not being paid well. I'm even wondering whether next month or maybe a few months to come, I'll see you people striking because your CB has not been implemented.
Yeah. Okay, there's just a mixed feeling of these Cuban doctors.
Yes.
And what they are bringing on board. But we are positive. We want to learn. We are really positive. But at the end of the day, after learning, then what? Yes, that is the question you're asking yourself. Then what?
All right. Now, as we move on, I want to see it this way. Now, what is in the mind of the government or the ruling government at hand? We have many young people out there. I know a good number who completed school. They are not anywhere in the medicine field. And here are the Cuban doctors. And if it has happened now, maybe sometime it will happen again, and it will become a habit. Now, what's the future of someone in school who is hoping to become a specialist in one of the hospitals in this nation?
Let me just repeat. There's just mixed feeling of these Cuban doctors. Everyone is just, waiting
To see
for
what
it.
happens.
Yes, to see what happens. Because I know there's a lot of like clinical officers cadre. We have a lot of them jobless, and yet we are saying, if you improve the health, the budget allocated in health, so many people out there will get opportunities in coming to work for the health sector and improving their lives, in improving the health of Kenyans. Yeah. So it's just mixed feelings.
All right. Now, on the part of quality and affordable health care, many other times people have gone to hospital and you're told there's no this kind of medicine. We want to understand, what do you think will be done to ensure that there will be enough medicines in the hospitals? Like, you don't have to be referred to a chemist out there, or there will be medicine in the facility that you visit?
Most of the time, I don't think our government think through the whole process in a year when it comes to managing the health sector.
And who is involved in the decision making?
For this year, I was not even involved. Like I'm mwananchi down there. I did not know even if there was public participation. I didn't know. I just heard.
I had the CS thank people who contributed in coming up with,
didn't even know.
with
Now
the budget.
let's come back to medicines.
Right.
It hurts when you go to a public hospital. Yeah. You go through the process, you go to the consultation room, you are sent to the lab, and then afterwards, definitely you expect to be given, medication.
Yeah.
So when you go to the pharmacy, you're told, unfortunately, this drug is out of stock. You just go buy out there now. What is the problem in between here? What went wrong? Yeah, we need to start asking ourselves, what went wrong?
And
Yeah.
yet there was money
And
allocated
yet
for
there
that.
was money allocated. Yes, yes. So is the problem the government?
Or the
Is the
procurement
problem
officers?
the procurement officer? Is the problem me who trust these people, the government, to you know, to secure my health? So that is what we are insisting, that as per the Constitution of 2010,
Yes.
every individual is entitled to a healthy, you know, a healthy life.
Yeah, and now I guess this problem also faces you as medics.
Yes.
Someone has been admitted, not like someone who goes for outpatient checkup. So someone who is inpatient, as a doctor, as a specialist in the hospital, you want to give this person medication, and then do you like also face the same thing? You want to give someone medicine and then it is not there. What do you tell them?
Hillary, the worst situation, I was once in an OPD. We had an accident. The whole of OPD, outpatient department, did not have gloves. These are people coming bleeding. Yeah, you need to arrest them. You need to, you know, perform first aid for you to move to the next stage. You don't have gloves. Now, if you don't have gloves, you yourself, you're putting yourself in danger.
True.
You're also putting the patient in danger. So there's just
And then what should be
There's
done?
just a
What do you think should
problem.
be done to solve these problems?
Number one, let us invest in community health strategy.
True.
From time to time, I've been here and I've been talking about community health volunteers.
Right.
I call them wonder workers because I work with them directly.
True.
A community health volunteer works from door to door, ensuring the families, the households they are, you know, targeting, the people are well. If they're not well, if it's a minor disease, right, they can actually, you know, give ailments, give medication. Yeah. Then, apart from that, 75% of their work is advocacy. They advocate for preventive measures. For instance, how can we prevent diarrhea? Number one, wash hands. 99% of the diarrheal cases, if you wash hands, you'll definitely have improved the vulnerability chance.
Yes.
Okay. So after doing that, they do referrals. If they get a case that they cannot handle themselves, they have to refer immediately to the health facility for this patient to get, you know, maximum cure. So number one, let me insist, let us invest in community health strategy where it's the community,
Yes.
the level one, you know, primary health care. Yeah. Number two, health financing.
Yes.
As much as we have been given 3.52% of the total budget allocated, let us not misuse it. You saw the other time like 5 billion. You can imagine 5 billion.
Yes.
What 5 billion can do in the health sector? One, it will employ. Yeah. Two, a lot of skills, a lot of skilled personnel, the consultants will be available. We'll have a lot of tools, a lot of equipment for diagnosis, and also medication will be there. So the amount allocated in health, let us please use it maximally, but not misuse it because of this, you know, and the scandals we are hearing, the corruption. Yeah. Then number three, it's called research.
Yeah, and our time is almost
Yes.
over.
So research, let us, you know, research is a forgotten field, but it's really important.
True.
Yeah, we've seen breakthrough interventions, breakthrough, you know, methods of how to, you know, treat simple pneumonia. Like one of the research that was done, it shows that do not use, you know, there's no need for needles when, you know, treating pneumonia, but actually you can use simple oral medication to treat pneumonia. So why can't we invest more on research to get these, you know, modern interventions and innovations
Yeah.
to work within the healthcare workforce?
Yeah.
Yes.
Just a follow up on what you said about the community healthcare.
Yes.
Now, we have so many people out there who have completed school, they
Yes.
graduated, and they have now. How do you incorporate them? As in, do you have a way of getting in touch with them and bringing them on board? Maybe through that, they may be appreciated or be paid for what they do.
I know, and that is what I'm telling the youths. Most of the community volunteers are, you know, 35, 37, you know, 40, above 35.
Yes.
Why can't we utilize our youths?
Yes.
Because these youths are the people who can use, you know, innovative, like our mobile phones, to actually treat a normal illness like malaria. Yeah.
True.
So there's a way you can actually enroll yourself. You go to your local administrator, like the chief. And then if there's an NGO who are interested with community health volunteers, they will pass through the chiefs and elders, and if your name was there, they'll definitely contact you to come and participate, maybe be trained, and also be involved in achieving health for all. So yeah, go to your nearest chief, go to your nearest elder, enroll to volunteering services. We have AMREF, we have Red Cross. Enroll, just volunteer. You never know.
Yes, yes. Now, I want in very few seconds your final thoughts. Do you think the government will achieve its universal health care through the budget allocation they have done, and your final thoughts?
Since we are having, executive goodwill, when you have political goodwill in something, it always, works. So let's give them 70-30%. 70% we can achieve. 30% we'll struggle a little bit. But since there's political goodwill, let's just trust the system. Yes.
All right. Thank you so much for making time for Y254 News Highlights audience. And back home, once again, thank you for keeping it Y254. It has been an awesome discussion. And for you, a youth that you have completed your medicine education and you're out there, you can actually enroll to be a community volunteer. And you never know, things may turn out to be good from that end. From here, it's a wrap. My name is